This presentation will begin with a video
from
their patient advisors.
John Robinson. More formally, I'm Dr. Robinson. I hold a PhD in applied mathematics and theoretical physics. I began my career as a research scientist working in computer networking. In August of 2012, I was at Meech Lake with my canoe, my granddaughter Layla, and my daughter Zoe, and my darling wife.
Thought you were going to forget me. Go on.
We were sitting on the side of the lake, enjoying the day and the company, when I was struck with a massive stroke. Fortunately, my daughter Zoe had taken the CPR program, and she was able to interpret the signs my body was making, and suspecting that I'd had a stroke, she went to talk to the lifeguard, who made arrangements to have an ambulance come. I'd had a massive stroke. The ambulance took me to l'Hôpital de Hall in Old Quebec, where I sat as a patient in the acute care section for a month until they transferred me to St. Vincent's de Paul.
St. Vincent Hospital, but you were at the Civic first, right?
Yeah.
Yeah.
First to the Civic Hospital, and from there to St.
Vincent's Hospital.
St. Vincent's Hospital in Ottawa.
Do you remember much about your stay in those different hospitals, John?
I was in very bad shape at the time, and I don't remember many of the details. I do remember, however, that my wife was very preoccupied with the things arising from the quality of care that I was receiving. Jackie will tell you more about these things in a few minutes.
Okay. I'll just tell you a little bit about myself. My name is Jacqueline Tetroe, and I'm obviously John's wife. Before I retired, when John was discharged from St. Vincent's Hospital, which is a subacute care hospital, I worked at the Canadian Institutes of Health Research in knowledge translation, and prior to that I worked in health research. And I have to say, it's one thing to study health systems research, and another to try to navigate the healthcare system as a patient or a family member. It was quite an eye-opener. And when John was in acute care, I felt powerless and starved for information about his health and the nature of his care. I saw many opportunities for improvement in his care and in the hospital system in general, but came to understand the immensity of the task in undertaking change in a hospital setting. Once John was transferred to St. Vincent's and out of acute care, and his care was very minimal and often begrudging and impersonal, I started to speak to all levels of management at St. Vincent's about the problems that we and other patients and family members there were experiencing, and had some suggestions as to how that might be improved. No real changes happened at St. Vincent's while John was still a patient there, and he was there for 13 months. But after John came home, we were approached to be part of an application for funding from CFHI to improve the admission and discharge process for patients and families. When it was funded, we had the opportunity to co-design the care experience, which you'll see is the title of our presentation. Part of the title is Co-Designing the Care Experience. Our role in our collaboration with St. Vincent's, and that's what I'm mostly going to talk to you about, is what our role was and what I think about collaborations between patients, families, and healthcare providers in shaping care. Our role has been to tell our story to various groups. And our story is John's story of admission, the sort of care and not care that he received at St. Vincent's, and the discharge process. So these transitions in and out of one facility to another it's well known to many people, these are very difficult points and perhaps weak points in our healthcare system. And I, with John, we spoke to a number of groups, the board for Elizabeth Briere, which is the umbrella organization that runs St. Vincent's, and different groups of healthcare providers at St. Vincent's, telling them about some of the borderline nightmarish experiences that we had at those transition points. And we have also participated and facilitated at a number of Kaizen events, and Sandra, who will be speaking after us, will explain more what a Kaizen event is. It's kind of a quality improvement think tank is how I think of it. And we've also are serving on the newly formed Patient and Family Advisory Committee at St. Vincent's. So that's the nature of our involvement. What impact has this involvement had? Well, it's still fairly early in the game, but I can say from what we've done, we've made many different stakeholders aware of what the patient experience can actually look like. And we inspired several change initiatives, which again Sandra will tell you about when it's her turn to speak. I'd just like to comment a bit on the nature of patient-centered care and patient co-involvement. And when these topics come up, the question arises as to whether or not the patients and family members are true partners or guests at the table. And the ideal is that there be a true partnership. But I've been reflecting on this a lot, and I think that whether or not this occurs depends on the level of commitment of both the patients and the healthcare practitioners involved. As a patient or family member, one can choose to tell a healthcare story and then just walk away and hope that the right thing is done. That's being a guest at the table. Alternatively, if you have the time and inclination to follow through on change initiatives, read documents, attend meetings, problem solve, and troubleshoot, then you can be a true partner in improving care. That's on the patient side. As a healthcare professional, one can listen to stories, express one's intention to correct the situation, thank the individuals for their input, and then walk away working alone or with colleagues to address the issues raised by the stories. And that's treating the patient as a guest at the table. Alternatively, the healthcare professional could listen to the patient's concerns, take the time to work through the solutions with them, and then truly involve them in every step needed to implement change. That's a true partnership, and it may require extra time, and it might mean you're going to end up moving in unexpected directions. A true partnership, in our view, and John and I have talked about this a lot, requires that both parties have the confidence in their own knowledge and experience and perspective to engage with the others at the table. It requires mutual respect. It requires a certain common level of knowledge, background knowledge, and knowledge of how to move forward to resolve issues within that particular setting. Our advice to healthcare practitioners on facilitating true partnerships would be, number 1, listen. Number 2, don't be defensive. Number 3, don't speak in acronyms, it's intimidating. 4, learn how to roll up patient stories into ongoing issues. I've found in my experience in being on committees and sitting in on different meetings, patients tell their stories, but they often don't see their particular story within the context of the healthcare setting in which they are or their loved one is. And it's up to the healthcare professionals to allow them to get some perspective and to imagine how things could change so that their or their family members' experience could improve. Also, healthcare professionals need to show respect to people who likely feel powerless, as I did, and don't know how to help but want to. So this is how healthcare professionals can help to facilitate true partnerships. And our advice to patients and to other family members is to have confidence in your knowledge and experience. Sure, you're not a healthcare professional, you don't speak in the fancy language, you don't have all of that background knowledge, but you've experienced the healthcare system in a way that they haven't. and therefore you have knowledge and experience that's complementary to theirs. Our experience in working with the Briere team, has it been a positive experience for you?
Well, I've enjoyed working on this project and on the Briere team, and I hope that I'm contributing in some small way to the progress that I believe they are making by improving the quality of the experience for the family and the patient as they move through this incredibly complicated healthcare system that we have.
And now we'll close now and let Sandra tell you more of the details about the project and the initiatives that have been undertaken. Thanks for listening to us today.
Thank you.
Thank you very much for inviting us to present what we're doing at Briere. We're very excited to be here, and I always say that our stars were aligned on the day that we got the announcement that we were part of the collaborative with the Canadian Foundation for Healthcare Improvement, because that has really accelerated our ability to move forward with many, many different initiatives to address some of the things that had been opportunities that we had wanted to be working on. So to give us some structure and education and coaching and quality improvement advisors has been an awesome experience for us at Briere. We also partner with our Briere Research Institute and with Dr. Bev Shea, who is a research scientist there, to make sure that what we're doing is evidence-based. So she performs systematic reviews for us to make sure that what we're doing and what we're working on is in fact evidence-based. Thank you. So I'll be brief with the slides in the interest of time. But what really necessitated many of our initiatives that we have gone forward with is our need to involve our patients and families and to provide care with them. Our patients had changed, and I'm sure many of you have noticed that as well. They're older, they're frailer, they have many more complex chronic illnesses. And we needed to address that, and we really wanted to bring initiatives to light with our patients and families. Oh,
I was
not
trying to
coordinated?
synchronize them, they were not
Are they excellent? So one of the things that we do is we invite our patients and families and to participate with us in co-design. And what that means is that we do make every effort to make them partners at the table, and full partners at that. And Jacqueline and John have been just an absolutely wonderful people who have just been so honest with us in helping us to really see some of the issues and opportunities that have come for Briere. And one of the things that they're part of course, is our CFHI core team. And we meet on a regular basis. We talk all the time. They come and give us feedback on all of our ideas, and they're really working with us on building these initiatives. One of the things, and we've talked about it this morning as well, is the commitment that is, and certainly, as you could see with Jacqueline and John, they are passionate about improving the healthcare system. And again, they have been just so wonderful with us at Briere. We're also looking at the IHI Always practices for sustainability in making sure that everyone understands that the things that we are doing are in fact evidence-based, patient-centered, measurable, and also very sustainable. As Jacqueline had mentioned, we have Kaizen events. Our focus for our CFHI project was based on transitions, but we've also extended that to initiatives to improve our care at the bedside. One of the things that we found at our first Kaizen was that the transition from acute care to our facility, which is a post-acute center, is very fast. They find out the night before they're coming to us. So they kind of feel like they're being shoved through the healthcare system. They arrived and they felt that although we were very competent about getting all the assessments done, the environment was not very welcoming. So what we did was we initiated came out of the Kaizen was a volunteer ambassador program, which we leverage on our wonderful long-standing, very dedicated volunteer population. And what they do is they welcome new admissions, they help them get settled, they answer non-medical questions, and they take them on a tour, both of the unit and also of our hospital. And what we find is that patients are now leaving the unit, enjoying the rest of the hospital, and we really, really appreciate the work that our volunteers have done in that program. We have a 100% success rate. So when we go into our evaluation, did you feel welcomed at our hospital? Our volunteers are definitely excelling in the job. And Jacqueline and John presented to our large HR group, which was over 100 of our employees, and we had employees come after that session and wanting to be volunteer ambassadors. So we're very, very happy that it spread to our staff as well. We also recognize that at discharge we didn't provide any written material. We have a working group with Ron and Marion Whiting that provide us with insights on the discharge process. And through this process, we also became research associates with University Health Network, who also is doing the same, working on the same projects. And this is one of those wonderful things of collaboration with patient-oriented discharge summary. And you can all look it up. But we are leveraging on their work, and we are now, our working group, including Ron and Marion, are now research associates. So we're just absolutely thrilled with that opportunity that has come through this. We also have a fridge magnet. Patients said that when we sent them home, they had tons of numbers, but they were all over the place. So what we do is we provide them with a fridge magnet with the calendar for their appointments and also their numbers, or their the frequently used numbers, including CCAC, which is very helpful. Always practices. We redesigned our care boards. Which everyone has whiteboards, but what we did was we asked our patients and families what they would like to see on them, and we also initiated 3 priorities for care. So we ask our patients and families, what is it about today that we can do for you that would be important to you? And we write those down to make sure that the entire care team does in fact know, and we have had very successful evaluations from our new care boards. We've initiated, and as Patty had mentioned, our advisory committee, which is absolutely excellent as well. Jacqueline and John sit on our advisory committee, but the other thing is to really hear the voice of the patient and for them to volunteer and say anything that you need. You know, we're happy to co-design initiatives with you. We're happy to learn, your perspective so we can add ours. And it's that collaborative nature that really has helped us to understand what's important to them and to focus on that. So Jacqueline also brought this up as to whether, are people that we invite guests or are they true partners? We make every attempt to make our advisors true partners at the table. And we talked about some of the strategies which we also use going forward. And it's to build an open, honest relationships. I mean, healthcare is not perfect. So by sharing our challenges with our patients and families, they actually have some great suggestions, and we build initiatives around those. And we focus on what's important. And I think that's one of the reasons that we have been so successful is that we aren't doing, as providers, we're not doing initiatives for ourselves. We're actually doing them for our patients and families. Make sure that what you're doing is actionable. So that's the last word that I have is that, you invite them to the table, you ask for their input, and, we come out with something solid at the end, and we work with them on it, right from the get-go, right from the idea development through to the evaluation. And I think so they truly feel ownership when it comes to developing things with us. And I tell you, it's a very exciting journey. We're at the beginning of it, but we're just so excited and looking forward to the future. Thank you.